It's Cancer Awareness Month, and I'm so glad that you've chosen to join me for this video. Tonight, I want to talk about what happens when our hair starts coming out during chemotherapy. And what I want you to understand is that it's different for every person. There's different kinds of chemotherapy, and they do affect your hair. And from what I understand from my hairdresser is that our hair and our nails are often affected first or the most. And so you lose your hair because the chemotherapy tends to just go there. And that's why with some chemotherapies, they have you use gloves and things for your feet that are cold. It's called cold therapy, and it keeps the chemo from going directly to your fingertips and your feet, which can, cause neuropathy for a short period of time. Your nerve endings are affected and become numb. So that being the case, your hair is definitely affected in some ways. For many people, it gets thinner or just completely comes out. And so what do you do with that? I chose to go to a local wig shop. I did not buy a wig that was human hair. I bought the synthetic hair, but I did go to a wig shop as opposed to ordering something online. And they took an hour with me. They fitted me for a wig. I chose a wig that was closest to what my natural hair was before it came out. Yes, I paid a little extra for it. I didn't pay $20 for that wig, but I also didn't pay $500 for that wig. So I took the wig, made an appointment with my hairdresser, and arranged. She was so kind. She arranged me to come at the very end of her day when no one was in the salon at all, and she shaved off the remaining strands of my hair. She fitted the wig to my face, and then she trimmed it. She trimmed around the perimeter of my face so that it looked like my natural hair. It was amazing. I had so many compliments on that wig that people actually thought, man, your hair looks great today. And it was a wig. But then, you need a wig for certain times, like if you're going to some kind of event or if you're just out in the general public. You may not want to wear one of those hair dressings that you can buy on the internet. Amazon's got them. They're kind of like a little toboggan that's made out of cotton, preferably cotton kind of cloth, which is very comfortable, very good for wearing around the house, and maybe outside some. But going out in public, like going back and forth to doctor's appointments or going out to eat, I had my wig. And wigs can be hot. They get warm. It's another thick covering on your head. So, just know that it's probably going to get warm when you wear it, but it definitely helps get you through the period of going through chemotherapy and the time afterward while you're waiting for your hair to grow back out. Some people's hair immediately starts coming back in when they stop chemotherapy. Mine took a little time, but then again, I'm on a chemo pill for at least another few months. So mine grew out slower. And when it came back in, like many, many people, my hair came back in extremely curly. I mean, extremely curly, and it grew slowly. And it was a different color even. So I went back to my hairdresser, had a discussion with her, and she said, much to my dismay, she said, let's wait a couple months and see if length on it will help relax some of those curls. So reluctantly, I agreed. In the meantime, she suggested getting really heavy moisturizing shampoos a leave-in conditioner as well as a rinse-out conditioner. And I use that, and I really found a good product that I liked. I really like Kenra products. They just really do have a special moisturizing content in them that really works. So I use that, and over time it took about 4 months, 5 months to even get the first haircut. And she trimmed it up and then told me to wait another 3 to 4 months, which I had to learn some patience, and I waited and we trimmed it again. Each time we trimmed it, each time it had time to grow some more, it looked better. It started looking more like my natural hair. And so I'm just telling you just to be patient, work with your hairdresser, because I know that they're seeing lots and lots of cancer patients, especially now. And this is especially good during Cancer Awareness Month. So I just want you to take time and let your hair grow. I'm about a year in, a little over a year, and my hair today looks more like my natural hair did. You may be asking, okay, can I color my hair? And you just have to check with your hairdresser. I know that every time you do processing to your hair, it dries it out. And let's face it, chemotherapy dries us out. So my hair during the period of time that I've been letting it grow out looked a little over-processed. Is exactly what it looked like. In fact, that's the way my hairdresser described it, that your hair just seems like you got two perms, one on top of the other, or you got more color right after getting color. And so I just caution you to get with a great hairdresser, let them help to guide you, and they'll make suggestions on what to get for shampoo and conditioners and things that you can do to keep your hair growing and growing out healthy. Because that's really what we want. We want to be healthy because we've been sick, so we want to be healthy.